morning. I am Adli Lebinsha, lecturer of Human College of Pharmacy. Today topic is hypertension. First we see about the definitions of hypertension. Hypertension is defined as a physiological condition where there is an increase in the arterial blood pressure above the normal level. Hypertension means increased blood pressure above normal. Normal BP level is 120/80 mm Hg. Hypertension may be defined as a physiological state where there is a decreased BP than the normal level. Hypertensions are divided into two types. First type is primary hypertension. It is also known as essential hypertension. Second one, secondary hypertension. Secondary hypertension is also known as malignant hypertension. Next, in the primary or essential hypertension means where etiological is unknown cause and it is known as the primary hypertension. Its factors are dietary intake of more sodium and less potassium. Next we see about the hereditary problems, age, etc. In secondary hypertension, the main etiology is secondary hypertension is due to renal disease, adrenal disease, etc. Next, muscular disease also cause the secondary hypertension. In muscular disorders, renal artery stenosis, encephalitis, thyrotoxicosis, and it is used oral contraceptives. These are the muscular disorders. Causes of hypertension. First cause is age. Second one unknown cause and arterial disease, oversynthesis of hormone, renal disease, genetic factors, is used for use drugs, alcohol, liquors. These are the causes of hypertension. On etiological basis, hypertension is divided into two types. First one primary and secondary. First one primary hypertension. It is cause is not known in primary hypertension. Factors affecting on the primary hypertensions are elevations of BP level. There are dietary intake of more sodium and less potassium. Second one, decrease in vascular synthesis of nitric oxide. Third one, in some cases it may be hereditary also. These are the factors following in primary hypertension. Second one, secondary hypertension. In some cases, hypertension may be secondary to other disease like endocrine disorders. In endocrine disorders, there are two: pheochromocytomia and hyperaldosteronism. Second one, chronic glomerular nephritis, muscular disorders. Muscular disorders are divided into two: contractions of aorta and renal artery stenosis. These are the two types of hypertension. Next, the classifications of hypertension. The hypertensions are classified into four types: thiazides, loop diuretics, and potassium sparing and aldosterone antagonists. In thiazides, examples of drugs are clothiolidone, hydrochlothiazides, indapamide, metozolamide, metozolone, in loop, bumetanide, furosemide, torsemide. Potassium sparing, amiloride, triambitarine. Aldosterone antagonists are spironolactone. These are the classifications of hypertension. In AC inhibitors also the drugs used in the hypertension. For example, captopril, lisinopril, enalapril, quinapril, ramipril, etc. In thiazide diuretics, the dose is given to take in morning. For more effective antihypertensives than loop diuretics is thiazide diuretics. For example, clothiolidone. Adverse effect of thiazide diuretics are hypokalemia. Hypokalemia means decreased potassium level in body. Hypomagnesemia, decreased level in magnesium, hyperkalemia, increased level of calcium, and sexual dysfunctions, etc. Second one, loop diuresis. Diuresis dose is taken in afternoon. In higher doses may be needed for patients with severely decreased glomerular filtration rate or heart failure. Adverse effects of loop diuresis are hypokalemia, hypomagnesemia, hypocalcemia. Loop diuresis drugs are furosemide. These are the loop diuresis adverse effect and structure. Mechanism of furosemide is inhibit the calcium and chlorine transporter in distal convoluted tubules and increase the level of sodium and chlorine excretion. Next, weak inhibitors of carbonic anhydrides increase secretions. Increase potassium and magnesium secretions also decrease the calcium secretions. These are the mechanisms of the loop diuresis. At last, the calcium channel blockers, depending upon the chemical structure, we are classified in the classifications of the hypertension. Drugs are diphenylalkylamine, 1,4-dihydropyridine, diaminopropanol ether, benzodiazepine. These are the classification adverse effect types of hypertension. Thank you.